We are. Go for it. Tell me, why does it give you a pitter patter?
That does bring fear. It gives my heart little, because, well, I'm not there and my brain doesn't automatically go that direction. Where with the patterns with 15 people, I'm becoming much more comfortable about visual assessment and even my measurements. Now that I'm into 15 people, I'm like, I'm going to write down anterior ASIX, and that's you're like the first one. So either I bypassed it, my brain didn't want to go, but oh yes, and I did it several times. So my pitter patter is because oh, I'm not there.
Not yet.
Yeah,
But
not yet.
but here's what I'm hearing that's so great. You're absolutely owning those neuroplastic patterns. You're owning them. You're giving yourself so many times to practice, so many at bats that they will literally be ingrained in your own brain. It's amazing. I told you in your track. Hi, Raul. Glad you're here. I told you in your track that that is how one of the ways that guaranteed you will win the game. If you take the training and you implement it like you mean it, meaning you know it and you take it into your treatment space, then you're going to have it. And then once you have all of that, you start seeing it differently. What you just said is you're seeing it differently is still a little fuzzy because we're still gathering all the branches to make the bonfire with. That's okay. That's perfect. And the place that you're going next is into deep diving clinical reasoning based on orthopedic assessments. So far, what we've done is visual and functional assessments. Now you're into orthopedic assessments. It's a different ballgame. It's a layer deeper, for sure. So it would make sense that you would feel not quite yet prepared. You're only halfway through the program, Debbie. And look at all that you created already. So I promise you, once you got through probable cause, you've done the heavy lifting. You're now primed to be thinking in this way. And so you're just going to practice it just like you practiced your neuroplastic patterning, and it will become autopilot for you just like that was.
Okay, and so I am in total faith and believing, but
Love
you know
that.
how I feel about the shots patterns. Like we're getting such good results, right? But the other day, I did have a moment where I thought, oh, maybe I can see where the orthopedic reasoning or clarity could be there. So I had a client, she had calluses on her pinky toes, and we were doing pattern checks. We were doing hashtag feet, toe lift. The pinky was lagging. And then it dawned on me, check her shoes.
Mhm.
Okay, well, at least it dawned on me. Like I felt like I was having next step reasoning, and so I'm trusting that that is coming, but I'm very comfortable in my patterns and my measurements.
Okay, well, if you're comfortable in patterns and measurements, what you're saying now, which is this is a progress for you since last week, what you're saying is that you're comfortable in both the neurologic patterning and now you're getting comfortable also in orthopedic assessments because that's what those measurements are. That's our orthopedic assessment portion of our method. If you're getting comfortable with orthopedic assessments, you can absolutely get comfortable with what to do about them. Next.
Yeah.
And there's a whole second set of measurements coming. As soon as you get all the measurements, you'll then next step is what do you do about them? How do you
Right.
clear them? We're starting that. You're already in, there's already seeds planted on all of that, which is when you start explaining how that orthopedic measurement came to be, whether you make up a scenario or whether you actually saw it in a client, when you start seeing how those measurements came to be present in that body, you're already in the game of the assessments of the implications. How did that happen? What occurred? What didn't occur that needs to be there? And what's needed from me to interrupt that what didn't occur or what should have occurred or what did occur that shouldn't have been there? Now you can start to see where you intervene to clear that all up. That's literally what's coming next.
Okay.
So interestingly enough, when I hear you say, I'm not there yet, I'm not there yet, you're actually a step ahead. You're a half a step ahead, which is why you're recognizing there's more. Okay. And from a leadership perspective, you are comfortable in your patterns. And now I love that you said today, and in your measurements. So you're comfortable in the neuroplasticity and you're comfortable in the orthopedic assessments. You get to keep saying you're comfortable with both. Last week when we talked here, you said, I only want patterns. I only want patterns. You started to say that today, but you're getting comfortable in your orthopedic assessments too. You need to tell yourself that because whatever you tell yourself, you'll believe. If you believe you're getting comfortable with it, then the next natural step is to solve it. Just keep telling yourself, I'm comfortable with orthopedic assessments. I'm comfortable with measurements. That's what you're saying. Measurements or orthopedic assessments.
I'm comfortable with measurements.
Yes, you are. Okay. And then what comes next is how to clear them. Natural next step. It's beautiful. Okay. Anything else coming up for you? For those of you who just logged in, hi, Raul, I'm glad you're here. I know there's others here live on YouTube. You caught us mid-conversation. Debbie's in our mastery program and in our club, and so we always start backstage with some client Q&A. And so we brought you into the tail end of that conversation. Debbie's working very, very efficiently with her clients and creating amazing results. And we're just at this juncture of like next stage development in our year-long program, which is a steep, deep dive. Debbie's here for it, by the way, for those of you who are just chiming in. And I'm reminding her, I'm reminding you, Debbie, that you're right where you're meant to be and right on time. And yet there's also questions that come along. So we were just answering some of those client questions. Do you have others, Debbie, from your client work this week?
Well, to the callus on the toe, the shoe wearing pattern, and I
Mhm.
was thinking what would be causing that, but then that stops me. I now I'm perplexed. And so, but that's next step reasoning, right?
Absolutely.
Okay.
Absolutely. And I love that you're like honest enough to say that thinking is where I stop. A lot of practitioners stop themselves there, and that's what prevents us from solving it. We just go back to what we're comfortable doing instead of resolving. They're not the same, and they do require more depth of training or knowledge, right? Like somebody recently just said, all you ever talk about is training. Well, I'm not going to apologize for that. We're all training forever if we're chosen the body as our muse, especially when you get into discrepancies like you're talking about. We know that we weren't born with calluses on our feet. How did they get developed?
Right.
Oh, from rubbing on a shoe. Okay, but why were they rubbing on a shoe? Right? Like you want to keep taking yourself to answer those questions, that takes some practice. But when you can answer those questions, then you can start to see everything and it all has an answer. If you never take yourself there, if that hard thinking, which is literally your brain changing in real time, if that hard thinking and clinical reasoning is something that you back out of, then you'll remain a service provider and be busy instead of clinicians resolving. That's the split right there, right? And you've heard me say this, Debbie, you and I have talked at length about this actually in lots of one-on-ones. Most practitioners at this stage of the game that are here working with us here in our community have been at it for a while. More continuing education doesn't necessarily take you deeper. It spreads the butter out on more pieces of bread instead of taking you deep into like, what's the recipe that made the bread? Like, how did we get here? How did we even
Mhm.
get to have bread? That is a
Mhm.
different layer that not all of us want to go through because it feels uncomfortable. Nobody wants to not have an answer. No one wants to fear that they're ineffective. And yet we remain ineffective without answers the more we avoid going there.
Right.
That's the paradox, right? And so you, specifically, I'm talking to you now, Debbie, you're here for it. That's why you said, I'm hitching my wagon to your train. Take me there. and you're literally at the halfway mark. You're right there on the precipice. These questions that you have where you say, I got a little, I don't know, got a little fuzzy. It's coming. It's literally the second half of the program. I
Okay.
promise you, you'll have more intel on what to do about it as we go. And you'll be looking at that for, I think, a while, like a while. I said this last week right here on Tuesday training. Once you complete a treatment plan because you assessed really accurately, you stayed in the game, you could see what was causing what you're witnessing and observing. You could put a treatment plan together based on what you implemented that treatment plan. The body responded favorably and you crushed today, like, oh my gosh, this person's no longer in pain. The very next day, a client comes in, that all starts over. Because now you're assessing something new in front of you and you're putting problem solution together on a new bit of history with a new body constitution and new orthopedic assessments that have now shown. And then you get to think through that again on implications and treatment planning, and then actually implement it. And then
Mm-hmm.
listen to see if that worked. And that listening to see if it worked is also a place where practitioners spook. Because they're like, I know I thought this through. I did the hard work. Like I did the thing, and it still only was an 80% result. I don't like this feeling of working hard and not getting 100. I'm going to go back to not having to think. Don't do that. Just keep on track. You will get there where suddenly you can see everything and the piecing together becomes more efficient. And then you're solving more frequently, but it's never rote memorization. Every new, I call it curtain three, every new person who comes in with an injury or a dysfunction or a limitation or actual pain somewhere, there's a whole configuration that created that result in front of you, that those collection of symptoms are now in front of you. You get to unpack every one of them. They're different for each person. Doesn't mean it's impossible. It means you got to train yourself to think about how to get through all of that information and then be courageous enough to apply what you know.
Mm-hmm.
So that's why I say it takes years to be clinically savvy. It takes years. But you have to be willing to go into the depths of the thinking first, which you are, Debbie. Most of us cash out there. It feels too hard. You're not. I promise you it's right around the corner for you.
Good. Leaning,
Leaning in.
leaning, leaning
Right.
in.
Oh, and look, Raul says in the chat here, he says it looks great after watching her progress. So you've been posting your client progress in the club, and he's observing that your results are looking amazing,
I have
right?
some more pictures. Yeah. My
Send,
camera is this gonna blow up. I've got so many pictures.
yeah, post them for us so we can all
Well,
see the progress and then learn
yeah.
from you how you got the before to the after. That's another, actually, this just clicked in. Maybe that's another place you want to go, Debbie. When you start getting your before and after, start explaining it, like maybe in the group, in the group conversation feed, start explaining how you created those results. Because once you can start explaining it out loud, you're explaining it to yourself. You're remembering that you did that. It wasn't just arbitrary luck. You planned that result. If you can start expressing that, you were talking about messaging earlier when we were backstage. What's the messaging? How would you describe to a peer, a colleague of yours? Look, this client came in like this, and the before and now the after. Here's what we did and why I did that and why it worked. There's your clinical reasoning.
Mm-hmm.
Start doing some of that, even with the patterning, the place that you're the most comfortable. If you can do it
Mm-hmm.
with patterning, you can do it with orthopedic assessments. You can do it with your measurements next.
I realized that one of the comfortable zones of the patterns and the measurements is because people are still.
Hmm.
And you kept, and I'm a movement professional, and we see, I mean, I see everybody's always moving when we're together, we're doing movement. But when they are not moving, that's really where, oh, look at that, or oh my stars, what's that about? Huh.
Yep.
because now I'm moving through the steps of gait, and now with roll through, they're moving again. And I'm like, whoa, wait, stop. When we did push up, you were standing still, and this is what I was seeing. And so, yeah, that I think that's probably another level of comfort to those patterns because people are still. You
Absolutely.
see that in measurements, people are still. So, but then I can see, oh, that's how our bodies are trying to help us when we're moving because things aren't well, like we're not well.
Exactly. See, you're piecing that together. Beautiful. And you're bringing up a really important point for all practitioners, manual and movement alike. Movement, dynamic action, where there's joint actions happening and muscles of reciprocal inhibition involved in that movement, is harder for you and for your client. There's more nervous system involvement in making movement happen. So they're already busy, so they're less available for you to correct them in that moment. And that means they're less available for themselves to correct, which is why we develop recruitment and compensatory patterns. So movement's tough. That's why it matters to me that movement practitioners know this so that your clients aren't getting hurt when they're moving with you or compensating from something they came in with that you didn't assess, that they're
Right.
not exaggerating when they're moving with you. And also, it's harder for you as a provider, manual or movement to assess movement because there's so many moving parts and you don't get enough time to sit with and then think about and then project onto and then alter when someone's in active movement. So it's harder for you too when people are moving to assess. The way you
Uh-huh.
get there as a movement practitioner, or even as a manual practitioner, if you're like looking at someone walk into your treatment room, is by getting, I call it, you've heard this before, Kodak moments, the still shots of all the pieces of the movement happening, what you should be looking for, meaning what are you assessing? Are you assessing for clean joint action? Are you aware of what muscles activating? Can you see alignment patterns? Can you see recruitment happening? Do you know what that movement should look like when it's what we call clean joint action through and through? Where I'm moving my shoulder, but I'm not also jutting my chin forward, as an example. Or I'm moving my leg, but I'm not also hiking the opposite hip, as an example. Like, are you able to see all that? Kodak moments, Kodak moments, Kodak moments. You've been amassing all of that in the program. First, what do you see? Then, what's the joint? Then, what's the muscle? And are you seeing that happening? Okay, you got all that? Great. Now, are you seeing something off? Are you able to assess what's off? And then can you reassign what the movement should be, what muscles should be doing it, etc. So we go forward, we stack, we go back, we stack again, we go back, we stack again, and then you're on to orthopedic assessments. So you have been doing that along the way. And then when you get to the implications of what you're seeing going wrong, this clinical reasoning that we were just talking about, when you have more practice at that clinical reasoning, what does it mean what you saw? What does it mean what they were doing? What's the implication of the movement happening this way or not happening the way it's supposed to? When you can start answering those questions, you'll be able to already see differently movement in dynamic action. Because you've pieced together each step that went awry, you can start seeing the steps awry as they're moving. So we're stacking again to get you there too.
Yeah.
It's just a bit of a process. It's not forever, but it's a bit of a process. And you're doing
Yes.
it. We're stacking the Lego blocks. You can feel that?
Yes.
Okay. Then you're right there.
Yes.
You're right where you're supposed to be at the halfway mark.
Okay.
You're right where you're supposed to be. I love it for you. Raul says the teacher shows before and after success in the group also helps others like us to understand the method with someone else's eyes. Yeah, great.
Okay. I'll post some more.
Yeah, the more we share, the more we learn. Good, Debbie. So you can download all your photos for us to learn from. We'd be happy for that. So good.
Okay. That would be a lot.
Hmm.
And Raul, thank you.
Yeah, he's a good team player too, right? Okay, babe, you're off. You're doing
Yeah.
great. Super proud. Anything else, Debbie?
No, not at the moment.
Okay. Well, perfect. You teed us up perfectly for today. I don't know if you knew the topic of today's training, but I literally titled the video, uh, The Transition from Service Provider to Clinician, like from doing the doing to solving the problem and coming up with resolutions. Nothing wrong with being a service provider. You guys have heard me say, actually, that we're in service to the people we're in service to. I believe that. Like we're providing, we're a service provider for sure. But the nuance here is that as a service provider, we could be doing rote memorization, following an order of things. The picture that comes to mind for me is for the massage therapist in the house. And we'll do personal training here in a second or yoga as well, right? Even Pilates. We all have like a format that we follow. You know, in massage, you start face up, you start face down. You do this much on this arm and that much on that arm. In personal training, it's like we're going to do warm up for a couple minutes and then we're going to get into strength. Okay, Debbie, we're going to get into strength and then we're going to get into some lengthening. So, and then we're going to do heart rate, right? And you like go through a framework, a system that you're doing. Pilates, same thing. We're going to do footwork first, right? We're going to start with the foundation. So we all have this like format that we follow when we are in service to someone else's body. Nothing wrong with that, by the way. Nothing wrong with that. The difference, though, that I'm here for those of you who are striving towards next level, is when you become and identify yourself as a clinician, which means you are directly responsible for what's being presented and the outcome that you're committed to creating. And you might think, well, but isn't the outcome to relax after an hour massage? Absolutely. Are you a clinician in that space? Maybe you could use the word in that way. However, what I'm introducing us to is most massage therapists do not identify as clinicians. Most Pilates instructors do not identify as clinicians. So if you're not identifying as one, what's the difference? To me, the difference is orthopedic results, making sure that the injury is completely rehabbed by you, not before they come back to you. Making sure that the pain that they're feeling when they walk in is eliminated by you, not by something they're doing that you got lucky on, like you planned for it to be solved. If you are a practitioner who's dealing with dysfunction, things aren't quite working the way you know that they could or the way we're designed to work, you're remedying that so that you are restoring the body back to its design and its optimal function by plan, not by luck, right? So that's the idea that comes to mind for me when I think about switching from service provider to a clinician who's directly responsible for the results that you're creating. That's what we're here to do in this community anyway. So on a professional development path in this community, I'm recognizing the need for clinical confidence. Like, how do you become confident in doing all those things I just listed out? I mean, Debbie was so honest and vulnerable and helping us see how we get there. And here she is back again, because that's literally what we were talking about. Like, how do we get confident in the results that we're creating instead of just staying with the to-do list of I can walk them all through these things and they all do really well until they don't. But what about when they don't? What's needed from you? Because there's always an intervention. When it comes to musculoskeletal discrepancies, there's always an intervention that you can offer at this next level. And then you start creating orthopedic solutions to the things that most others might just pass over or modify or be spooked by, which don't ever be spooked. I'd rather you modify and not create more harm than and keep your groundedness than to spook and not know what to do whatsoever. So that's the track that we're on. We've been leading up to this all year, and we're definitely starting 2026 nice and strong with this in mind. What I'm looking for is for those of you who identify as a practitioner, but you're sensing that there's a gap between what you're doing and what you're thinking about. Could be a couple things. Either you're thinking nervously, but you're doing with your fingers crossed behind your back, or you're doing based on that structure that we already talked about because it's what you've always done. So then it should apply, right? and you're thinking that there's something missing, but you don't know what's missing. So there's doing and thinking, doing and thinking. If there's a gap between those two for you, you're not actually sure what you want to be doing or what needs to happen, then you're looking for next level. And that's beautiful. If you're not there, there's nothing wrong with that. You just get to pick your lane, like decide for yourself so that you can be free in your decision instead of plagued by it, right? Be free in your decision. Most practitioners who want to be doing next level work are likely under earning. You're likely under, if that's you, you're likely under earning. I relate to that. I was too for a long, long time. We're under earning because we're under recognized and we get nervous about raising our rates because we feel that raising our rates is risky based on the results that we have not produced. So that leads us back to, well, if you produce the results, you'd be more confident and then you would be not under earning and you would not be under recognized. So that all feeds into itself, actually. So if you're looking for legitimacy and confidence in the structure in which you work, then you get to find a structure that builds your confidence and has an effective results-based structure. That's what we're here to do. That's what we're here to do. So what I think is needed for service providers who are converting over to be identifying themselves as clinicians, what I think is needed in that is your thinking, right? So we've talked for a lot of weeks about clinical reasoning. What's clinical reasoning? Clinical reasoning is that place where, Debbie, I don't know if we were already live, if we were still backstage and we were talking about it, but that place where most practitioners stop because it's uncomfortable. If you're thinking, gosh, I just don't know, like I think I'm supposed to know, but I don't know, or I feel like somebody else knows the answer, but it's not me, or if you're doing any of that internal chatter, then you're holding yourself back from clinical reasoning. And if you knew at one time how to create a plan that worked, and then you let your, like you took your foot off the gas a little bit because you thought that that would always and forevermore be the answer to all the client work that you did, then you gave yourself false pretenses because I already said today, once you learn what's needed, the implicate how to assess what the implications are of what you assessed, what's needed based on what you assessed, and you've had at bats implementing it, and then been patient and honest enough to let the feedback come on whether that worked and be okay, like objective connection to your results, just it worked or it didn't work without throwing out the baby with the bathwater. Oh, I tried and it didn't work, and so I obviously don't know what I'm doing. Don't do that. Clinical reasoning means you're willing to stay in the heat of what you're thinking and what you're processing, and you are not affected or afflicted by that heat. You're only driven towards the result. And that is a different level of thinking. Most humans, by the way, don't like to do that. We don't like to be uncomfortable. We don't like to feel like we're unsafe by not knowing an answer. We don't like to put ourselves in harm's way. In fact, there's part of our brain that's wired to literally do the opposite. So the skill of clinical reasoning requires discomfort, repeated discomfort, and most don't hang out long enough to get there. But if you know that that's what you want, then you'll hang out longer because that's what is the difference between a service provider who follows a repeated framework versus a clinician who's committed to being directly responsible for what's being presented and its results. And that leads me to how do you get through clinical reasoning? Like, what are the building blocks of that? Based on what? So you're knowing about what you assessed, what you observed, and what's needed. You're knowing about all three of those is based on what? Confident in your decisions, more practice at bats, which means more practice, right? It doesn't mean forever and ever and ever and you'll never get there. It means just more at bats so that you can know and know like you know, like you know what you assessed, what it means, what you observed, what it means, what's needed based on what you know, and the results give you more intel, right? So not every swing is a home run, but the more times you swing, the more chances you have at a home run. So you get to like be in your knowing and implementing. And then you build trust. So the difference between a service provider's mindset and a clinician's mindset is that they trust themselves because they have had more at-bats, they have swung the bat more often, and they start knowing what their implementation means. If I swing the bat this way, I will hit a home run. If I swing the bat that way, I will miss and I won't get a home run. If I swing the bat that way, but then I add a little bit more of this, then I get these results. If I swing the bat that way and I don't add more of that, I get those results. Which results are needed for the client in front of me? You get to trust yourself in being able to strategize in that way once you've taken yourself through the clinical reasoning. You're based on what, and now you're implementing and you're trusting because you have results. You've stacked your results. You've stacked your results. And again, if the first time you swing the bat, no matter how much you've trained in training, if the first time you swing the bat and you don't get a home run and you take yourself out of the game, you weren't really there to win the game. Because winning the game means sometimes you swing and you miss. Winning the game means sometimes a player on the team strikes out. It doesn't mean the whole game is lost. But if you take yourself out, then there's no game. You got to stay in the game and be willing to measure your results and be, again, objective in your connection to them, meaning it's not going to take you out. You're not going to melt under the pressure of not getting a home run each time. But what you're going to do is build up your resilience and you're going to add more grit and you're going to come back and be like, damn, I tried and I did this and I did this based on this and based on that. And these were the results which I was not anticipating. Help me figure out, what did I miss? What did I not see? Right? That's being open to feedback, that's aligning with the right community, that's being vulnerable in the face of a mentor and trusting that you're going to get there faster because you're willing to ask and then implement differently. You got to get back in the game. Can't just talk about it. Talk about what was missing. You got to go back in and actually try again. That's like the more at bats, right? The more people who swing more often, the more people who keep themselves in the game are more likely to win than those who aren't even playing. And that is a different mindset. It's a different mindset. Like losing is not an option and it won't take me down because I'm here. I'm going to keep going until I get it. All right. And then when you're a clinician instead of a service provider, you become more recognized for what you do. You recognize in yourself what you're doing and the results that you're creating. You start to recognize like, hey, wait a minute, I have a track record here. I actually I actually hold my own and I am grounded and present and I'm assessing really clearly and measurements are becoming easy for me. Orthopedic assessments are logical and what's needed is starting to really click and it's making more sense and I don't have to struggle so much anymore. And I'm creating all these results. Ah, I'm actually up to something here. I do know what I'm talking about and I do know how to create results. And then you can start collecting your results and your bandwidth starts to speak for itself. So one of the things that Schatz method practitioners ask me about a lot is like, well, how do you get to 4 sessions? Like what do I need to do? Just tell me what to do for those 4 sessions. It's never a checklist. It's exactly what I'm sharing here. Clinical reasoning and being comfortable with the discomfort of not knowing and committed to finding the answer until that discomfort turns into knowing. And when that discomfort turns into knowing, then I check myself based on what? It's like I give myself my own internal quiz. If you're melting down at a multiple choice quiz after a CE course, then there's some bandwidth there for you to grow so that you can actually quiz yourself and be like, I know how to answer this. If someone asked me right now, I would have words for it. Great. Trust that. Trust your knowing and then go implement. Be courageous enough to be in the space with your client and have to pivot in the moment if needed, if that's what's required, and then wait for the results to pour in. When you're in that space over and over and over and over again, you'll probably recognize yourself as a clinician who solves problems and who's confident about that. You become more well known within yourself and within your community. People start referring to you because you did it for them, you could do it for someone else. And then you have more traffic in your private practice, and then you're offering more value because your results say I'm offering more value. This is now what I'm creating in treatments with clients. And when you can create those results, and you can, then you can start charging more because people want high value. They want high value. I'm not saying you charge more because your arrogance tells you that you're worth it. I'm saying that you can measure what you're delivering. And if you're delivering something that isn't available in mass by all the other practitioners on your block, then of course you get to charge differently for that. You're creating a different result for them. That's just how it works. And you become really easy about the knowledge about your value because you've measured your results, which is step three, right? That's step three. So I do hope that there's value here for you. Let me know what landed for you. If you're in that place where you're like, yes, I do identify as a service provider and I am converting myself now to clinician. Maybe this is your resolution for 26. Maybe 2026 is your year. We are here for it. We are locked and loaded, ready to go. This is what all the training is about in 2026 inside our programming and inside our community. Let me know if that's how you're identifying for 2026. I would love to know you because there's not that many of us that are doing that. Our pool is smaller because the deep dive is deeper, it's not wider. Let me know if that is how you recognize yourself to be as a practitioner. I would love to know you by name and face. I'm wishing for you the most wonderful, joyous end of this calendar year and the most beautiful start to your new year, 2026. It is promised to be the best year yet on record. I am here for it. I'm here for it for myself and for the people that I serve, and I'm here for it for the practitioners who are training alongside me. If that is you, I am delighted. We are gearing up for a magical 2026, and I cannot wait to see you guys all at the start of the new year. I'm wishing you so much goodness between now and the next time we see you. Next week, we have all of our most popular Tuesday trainings for practitioners ready to load for you. So on our YouTube channel, we'll still be here training you. Maybe there's a few videos and trainings that you haven't seen yet, and you get to implement them as well as we go. Yes, you're ready to go, Raul, 2026? Okay, perfect. Fantastic. I'm glad to have you. All right, my friends, I will see you live 2 weeks from today. All the blessings to you between now and then. Bye for now.